When do you consider bipolar spectrum illness as opposed to unipolar depression? So there are certain non-manic markers. And by non-manic markers, I mean these are historical features of the patient's history that don't have to do with symptomatology related to manic symptoms, and yet tend to indicate that the patient is on the spectrum. These kinds of patients tend to do better on mood stabilizers rather than antidepressants. They tend to have side effects from antidepressant medications like SSRIs. So example non-manic markers: early onset of first depressive episode, so teens or early 20s. For women, a hormonal component to the mood symptoms, so PMDD symptoms that get worse around the menstrual cycle. A seasonal component to mood symptoms, so patients who do worse in winter seasons than they do in summer and spring. Rapid onset of depressive symptoms, so even when the patient's going into a depressive episode, there tends to be a rapid switch rather than a slow onset over the course of a couple of weeks or so. It's like they wake up one day and they're very depressed. That you want to be thinking of bipolar spectrum as well.